Welcome to Michigan Reimagined, a spotlight podcast. And here's your host, Chris Buck.
So healthcare has historically been an important topic, but even more so as we navigate our way out of a global pandemic. Here to talk about one local university's endeavors and a new partnership is the Executive Vice President for Health Sciences at Michigan State University, Dr. Norman Beauchamp. Welcome to the show, Dr. B.
Thank you, Chris. I'm so glad to be here. And the title of your program, right, Michigan Reimagined, is so fitting for what we seek to do.
That's wonderful. Well, we're going to explore a lot of great news that you've got and just hear a little bit more about everything that's going on campus and off. So let's begin by having you explain kind of the setup, Michigan State University's health sciences kind of organizational structure. What do you oversee? What are all the kind of divisions and departments?
Absolutely. So Michigan State University has the largest health professions training program in the country, the largest.
Really?
For example, we graduate 500 physicians every single year. Within the group that I oversee the two medical schools that we have, the College of Osteopathic Medicine and the College of Human Medicine, the College of Nursing, Public Health, which is in the College of Human Medicine, and then our clinical practice, which is Healthcare, Inc.
Wow.
It's those combinations.
Okay. And so what kind of faculty and staff do you have? I mean, I had no idea, honestly, as a local resident. And again, I'm not a Michigander originally, but I wouldn't have told my parents who don't live in state that Michigan State was the largest medical
One of the
school.
things I would say about Michigan State is we're humble. Yeah. We don't talk enough about these things. I think it's important for people to know that. So I appreciate it. So for example, we train doctors across the state. We also train physician assistants. We train nurses as well as advanced practice nurses. And then we have public health professionals, and those can be social workers, they can be geographers, they can be researchers. The faculty is made up of PhD scientists of all types, epidemiologists, biostatisticians, physiologists, people really dedicated to transforming health. And then so much of our group are the educators, which may have a background as physicians or nurses as a part of the team. We then also have our clinical practice, which is quite substantial. We have a large primary care base here in Lansing, and then a number of subspecialists in the different areas of medicine.
Okay. And you recently announced an affiliation with Henry Ford Health. Can you share a little bit about what that announcement was and why is that important?
Yeah, Chris, thank you. I grew up not far from here, St. John's, Michigan.
Yeah, right on.
I left in 1991 to do my medical training there. So I came back in 2016 with the hope of really transforming health for the state of Michigan, really improving it. Michigan, as a state, is ranked 35th, with one being the best, 50th, right, at the bottom, 35th in the nation for health outcomes. And the goal was, could we bring together research, education, and clinical care in a way that would improve the health of the people of Michigan? And what I observed was that Michigan State had a reach into every county in the state of Michigan through extension and through its community-based medical schools and nursing. And the idea was, could we increase the human health research? And so we started recruiting some of the best scientists from across the country and enabling those that we had. And then the final piece was, could you connect that to a large healthcare delivery organization? So you'd have research, you'd have education, but then you'd also have the way to take those discoveries and bring them to people everywhere. We had the connections in the community. But what Henry Ford brings is they have 33,000 people that are involved in the delivery of healthcare. They have 250 sites, and they do about $100 million a year in clinical trials. So it was the feeling that if you could bring together the nation's largest health education platform, connect research, and then connect clinical care, we could outreach to every single county in the state and improve health. And that's really what this represents. It's bringing together the organization's research, so we're combining that. Our educational missions, we're combining that. and as fully as possible integrating our clinical programs.
Can you share just a little bit more so I really fully understand what makes Henry Ford different than other hospitals that I, as a citizen, have kind of heard of?
Yeah, you bet.
I mean, I've heard of Henry Ford Health too.
Absolutely.
But it seems like their style or their penetration or their geography makes them the best fit.
There's one of the things I'm really proud of is that we have a community-based medical schools. What that means is we work closely with McLaren, with Sparrow, with Corwell, with Munson. It's deeply a part of what we do. So when it comes to education, that partnership, it's across the state. So we can train the practitioners that will be in those communities. Really important. We do really strong partnerships in clinical care here in the community with McLaren and with Sparrow. What Henry Ford brings is really the history of research and innovation. The last 100 years, it's been something that they focus on. And what you want to do when you form partnerships, right, is find complementary skills but similar core values. So what was unique about Henry Ford was that, they have a deep commitment to discovery. One demonstration of that is the National Institute of Health funds research. Henry Ford Health had the same amount of NIH-funded research as Michigan State. Really unique. So in combining it, we instantly double that magnitude. And that was what was unique. The other thing that really stood out for us is health disparities is one of the biggest tragedies that our country faces. COVID amplified it, in proximity to Martin Luther King Jr.'s birthday. You think about one of his quotes, of all forms of inequality, injustice, and health is the most inhuman. And this idea that by working with Henry Ford Health, which is so critical to taking care of the people of Detroit, we felt we could better partner to address health disparities in a way that Michigan State previously wasn't able to do all the way through to healthcare.
And there's a complementary or congruent problem rurally too, right? You mentioned earlier about all the counties in the state, right? And not only is there, there are food deserts and lack of grocery stores in certain parts, but there's also healthcare deserts, if I'm not mistaken. And this is kind of speaking to that as well. Is that right?
Exactly right, Chris. And when we think about health outcomes in the state of Michigan, you can go county by county and you can see huge variability. You get at one of the key parts, which is there's disparities in access to food, healthy water, jobs.
Right.
That's a part of our work. But the other part is access to health screening and to health providers. And one of the things that this will do is help us discover new ways to overcome the barriers to access, but then advance those solutions to people in the communities in which they live. If we look at health outcomes for our state, for example, the cancer incidence in rural Michigan is lower, but the death rate is higher. And some of that is just the inability we have to reach out to the communities. Another key strategy for us is we're training our doctors and nurses in communities, so they'll be in Marquette, they'll be in Traverse City, they'll be in Detroit, Flint. And part of the goal is that they'll fall in love with those communities. Mm-hmm. They'll see the beauty of that. They'll come to understand the needs of the communities. And that also increases the likelihood. So by coming together with Henry Ford, we'll be able to train more practitioners in urban areas. We'll also be able to train clinicians that are more steeped in innovation. And it's those innovations that'll help us do more of the outreach.
So I'm hearing that this whole partnership is also kind of a talent play, right? So, you've got a lot of students, they're coming through. They need to have a long education and time in the field. I forget what all the different lingo is for steps that they take before they get their certifications. And so, you're growing your own talent, and then you're deploying that talent, and hopefully a lot of that talent will stay here in Michigan and fill some of these roles. I have a large cousin contingency in very rural New York, and their only doctor in this 5,000 person town retired. There is no doctor in their community, right? So, I mean, anyway, so my point is that, you've got all these people coming through. It sounds like there's an opportunity to really place these folks to get that kind of coverage, whether it's the city or the country or, the medium-sized towns. And so it seems very strategic.
It's
to
very
solve the problem. Yeah.
Chris. There's a statistic that 20% of the population lives in rural Michigan. 8% of the providers live in rural Michigan. So there is this incredible mismatch. I have relatives in the Upper Peninsula, and they talk to me about how do they get access to a doctor or advanced practice nurse, and we have to overcome that. And one of the drivers of practitioners staying in state is not only where they go to medical school, but where they do that next phase, which is residency.
Residency, right? Yep.
And so we're going to be able to substantially increase the residency slots by this partnership with Henry Ford, which again will help us with that retention. Really important.
And all these other hospital chains too, right? I mean, this isn't an exclusive relationship. I mean, like you mentioned, Sparrow and McLaren and Munson, and
it's a critical point that you make. What I see the biggest impact in our training programs with Henry Ford will largely have that urban focus, training those students to address some of the disparities that are based on race and ethnicity, and that will nicely complement our strengths by the training programs that we have in 7 different communities across the state.
Right.
One cannot. What I love about there's a quote by Helen Keller that says, "Alone I can do so little; together we can do so much." And what I believe defines Michigan State is just this idea of partnerships. And so if we're going to train more, right, it is working with all of the health systems across the state. And we've been really successful with that.
Now, in my research, I read that you were hoping to double your nurse student population. When I sit at home and go dark in my mind about the things that are going wrong, I read and I think about people fleeing careers in healthcare industries and teachers and people that are really doing the world's most noble work and basic, just institutions of what it means to be a human, if not an American. Healthcare and doctors and nurses and teachers should be things that people are flocking to, but somehow they're being repelled from. And I suspect that there were problems already, and then COVID just kind of tipped it over. My question to you is, how are you going to double the amount of students going into a career that at least the press tells us people are kind of fleeing from? I mean, there are strikes and people, overworked and underpaid and those kinds of things. So talk to me about the strategy behind that.
It's such an important question, Chris. And the idea of how do we increase nursing workforce is a really good example. And you're talking about it, one of the term that we often use for this is burnout, right?
Yep.
And it's as high as 40% in the health professions. And it comes from, and it leads to this sense of reduced accomplishment, loss of identity, and that you can't do the work you came. Where does it come from? Excessive workloads, administrative burdens. I think lack of social support and work-life imbalance. And when you think about what happened in COVID, right, the nurses were on the front line, right? 60% of the care was delivered by nurses. Workload expanded dramatically. The unpredictability of the day expanded considerably. And then at the end of their day, they often are the people that are the supports for children, grandchildren, community. And so this burden coming at them from all directions, I think, is one of the big drivers of stress and burnout. It affects so many people, but particularly the folks on the front line. Teachers, another example.
Yep.
And so our approach to this is maybe threefold. The first is let's make sure we're providing the nurses that we have the supports they need, the tools to take care of patients and not be overwhelmed by administrative burdens. You look at just checking in patients, that can take an hour for a patient, but so much of this work can be streamlined so the nurse can do the work that's fulfilling with that for them, which is to be with the patients that they train to be with. So one is, how do we help that work? We have to also then think about how do we train more nurses, that understaffing, and that's the issue.
Right.
And
more
so
people helps defray the
more
stress.
people.
Yeah.
And one of the areas that we are looking at are more partnerships. Henry Ford is going to give us 100 training slots for our nurses. Really important. And then I think the other part is, if we're going to train more nurses, and retain more nurses, preparation for the job. About 40% of nurses will leave the profession in the first couple of years because they show up and it's really hard to prepare you for day one of the job. And how you do that historically is training students in hospital settings. But as those slots are limited, preparation can be challenged, or you're gated in terms of how many students. So the approach for us is going to be simulation.
Okay.
We have had support from donors. We're working with the state, and we believe that by creating simulation centers, both at Michigan State and with other partners, we'll be able to double the size of our training programs. Now, you asked the question, with the stories of people leaving the profession, are the number of applicants to the programs decreasing? It's actually surprisingly, or maybe not to me surprising, to the contrary. What is still the case is people want to do work that improves the lives of others. Our applications have never been higher for our nursing schools and for our medical schools. The students want to go into these fields. We just have to empower and support them,
right,
and make sure that we get the workforce right.
Well, that's great news. That's great news. Last topic, because we're starting to get close to end of time, is this new partnership. There was a kind of a promise or a loose announcement that there's going to be a new facility created to kind of cement this affiliation between Michigan State and Henry Ford Health. Talk to me a little bit about that. Where roughly is it going, and what kinds of things are going to be done at this new facility that you can't do now?
Thank you, Chris. And you and I had the opportunity to talk a little bit about the work in Grand Rapids, which creates this innovation district, which really brings together clinical care, education, research, and then bringing industry partners side by side. It's in those ways that we'll address the social determinants of health, both training the next generation, improving care, discovering new ways to provide care, and then enabling businesses that can create these solutions and disseminate them. We were able to do that in Grand Rapids, and that's really the vision for what we can do in Southeast Michigan.
Okay.
In creating on their campus, they're doing a campus redesign. We committed January 2021 that we're going to build a research building on the campus so that we can train more researchers to do this work. We already have moved 100 researchers into MSU appointments, and our goal is to add another 40. So our commitment is to build a research building on the campus. We foresee a medical school, as well as some buildings that would be related to recruiting industry partners.
Fantastic. So Michigan State University, obviously located in mid-Michigan. You've got a West Michigan footprint that I know, personally and professionally is certainly thriving, and this will be the Detroit kind of extension of that same kind of setup and model. And you'll have East, West, and Central kind of covered, and
it's exactly right.
That divide and conquer. That's fantastic.
Health for all. That's our goal. Health, hope, and healing for all.
So how can people kind of follow along, pay more attention to this? Does MSU or Henry Ford Health have some sort of a website, social media?
We do, and it's healthsciences.msu.edu. Has all of the details, and it has links to the work that we're doing. And one of the reasons an opportunity like this is really important for us is we think that in order for us to be successful, we have to partner. And so getting the word out and having anyone that's interested in improving the lives of others reach out to us, really critical.
Fantastic. Well, we've been speaking with the Executive Vice President for Health Sciences at Michigan State University, Dr. Norman Beauchamp. Thank you so much for spending this time. You're doing fantastic work. Keep it up. I'll help any way I can.
Thank you, Chris. Appreciate you.